I Hate Politics is a podcast about a human activity we love to hate. I'm Sunil Dasgupta. This week, I speak with Heather Dublinske, the COVID-19 coordinator for Montgomery County Public Schools. If you've been frustrated with MCPS decision-making during the pandemic, you will want to hear Dublinske's perspective. Our conversation reveals deep structural gaps in decision-making, including a lack of a formal agreement called Memorandum of Understanding, or MoU, between MCPS and the county's health department, setting out who is supposed to do what. There are plenty of task forces, work groups, design teams, and many MOUs govern other aspects of the relationship between MCPS and the health department. But there is not one for COVID. You may ask why it is even important in an emergency to have a bureaucratic document to organize and coordinate action. But political science will tell you that it is precisely in an emergency when formal, written-out procedures are the most robust. If you are new to the show, I Hate Politics is a podcast about our neighborhoods, workplaces, schools and streets, and our local governments as they function in diverse and democratic societies. This means our politics are messy, dirty, sometimes corrupt, with often self-serving politicians. But no matter how much we may hate politics, we are never exempt from it, even when we refuse to participate. In fact, the purpose of politics is to keep society functioning precisely when we don't agree with each other, like now. It is my hope that this podcast will help those who feel left out reconnect in our local communities. Music for this episode comes from Two Truths, a Rochester, New York-based electronic Americana band led by composers Blake Pattengale and Garrett Mader. Mader grew up in Montgomery County and is named after Garrett Park in Kensington. They are accompanied by Max Greenberg on keyboards and Byron Cage on drums. The song, Brushstrokes, can be found on YouTube. The band's first EP, Electric Campfire, comes out this month.
When I was a younger man, I chased you through the fields that we painted with soft brushstrokes.
We begin this week's news roundup with an announcement. Manna Food Center and the DC Food Recovery Working Group are hosting DMV Food Recovery Week 2021 starting Monday, October 3rd. The whole week is full of events where you can learn easy things you can do at home and support the community to reduce food waste and increase food security. The week culminates on Saturday, October 9th in an event where local chefs will compete in a no-waste, big-taste cooking competition. This will be held on the downtown Silver Spring stage located on Ellsworth Drive pedestrian walkway. I'll be there. Come say hello. You can find out more information about the week's food rescue activities at dmvfoodrecovery.org. Montgomery County's proposed new general plan, called Thrive 2050, is now in the hands of the County Council. The general plan is a once-in-a-generation document that guides land use policies in the county. It is different from master plans, which are more concrete and geographically or functionally limited documents. The proposed general plan, devised by Montgomery County Planning Board, has become controversial for suggesting upzoning in areas close to transit. Upzoning refers to a change in zoning law that allows landowners to build denser housing. Typically, most buildable land in the county is reserved for single-family homes. The new plan proposes to allow duplexes, triplexes, and sometimes more dense housing in areas of high demand near transit. With the County Council examining the adoption of the plan, several folks and organizations have spoken up for and against it. The latest to speak up is the Office of Management and Budget in the county government, which has estimated a one-time net countywide cost of Thrive plan to be about $8 billion, give or take $2 billion up or down. In an analytical note, County Council staffer Glenn Orland further said that even at the lower end of $6.4 billion, it means additional annual capital spending of $220 million between now and 2050. Further, county government operating costs would go up by $623 million, which is a 12% budget increase. The planning department has pushed back against these cost estimates, calling them too speculative and contradictory. For example, the calculations take into account the cost of extra services for an expected 200,000 net increase in population, but fails to take into account the growth in tax revenue. The planning department has also argued that this is the first time a general plan has been subjected to cost estimating in this fashion. A recent plan for county highways, for example, was not subjected to similar cost analysis. And certainly, previous general plans from 1964, its amendments in 1969 and 1993 were not put to the cost crucible. And this is because the plan is a guiding and aspirational document that does not lend itself to cost estimating like a smaller area master plan might be. Montgomery County government employees unions are agitated over a possible vaccine mandate for county workers. MCPS already has a mandate that is supported by the teachers union, but there is a petition against MCPS's vaccine mandate doing the rounds in the county. One argument against vaccine mandates is that it will cause employees to quit, leaving already short-staffed government offices and schools and libraries and health centers, not to forget fire and police stations understaffed. We have heard of the bus driver and teacher shortages across the nation, but here are some numbers locally. At MCPS's West Farm Depot alone, there's a shortage of 70 drivers. Usually, the depot has about 400 drivers and is now down to 330. On teacher vacancies, on September 15th, MCPS had listed 574 open positions according to its publicly available careers website. Of these, 274 were for classroom teachers. On September 25th, these numbers had jumped to 715 total open positions and 379 classroom teachers. Just to underline the point, between September 15th and September 25th, the number of open classroom teacher positions in MCPS increased by 105. On Facebook, my friend and Northwood High School ESOL teacher, Chris Wilhelm, sounded the alarm.
We're seeing a few layers of things, I think. I think there's a general level of stress and a feeling of being overworked that already existed before the pandemic within Montgomery County Public School staff and I think across the country. And, the year of online teaching was not easy for people. And now that we're back, we have some new challenges. And I'm just hearing from colleagues and feeling some things myself that the level of extra tasks that are being piled on educators and support staff is just getting to an unprecedented level. And I think people are burning out much faster this year than usual.
Do you see teachers bearing some kind of extraordinary cost over and above what other people are?
I don't think so, really. I think that the way our society is set up has caused a massive amount of stress for many, many people. So no, I don't think the teachers are especially stressed compared to other professions or even people who are not employed right now. But I think for us, we're feeling that our jobs are different than they were a couple of years ago, and it's not feeling good for people. And
people are going to leave as a consequence, is your argument, right?
I think some people will. And, we already saw before the pandemic a very, very high rate of teachers leaving the profession before they get to their fifth year. And I think that, I've seen it at my school, at Northwood High School, and anecdotally across the county, people that I know in ESOL and in other departments who have decided either to leave teaching or to resign and stay home with their kids if they can manage that. I know that's been a stressful thing. Several colleagues from Northwood and folks that I know from across the county have left to teach in Frederick or Howard, closer to where they live, or they're feeling like the long commute to Montgomery County has become not worth it for them, and maybe some even feel that MCPS is adding burdens that other counties are not.
Could you identify what these burdens are that MCPS is adding that other counties are not?
Some of the additional burdens that we're feeling are at a lot of elementary schools, especially teachers being expected to cover lunch and recess periods, which is explicitly against the contract that we have with MCPS. Teachers having to stay after school because of the shortage of bus drivers, and many students staying for up to an hour after school because of late buses.
Well, how do you fix the problem? It's not like we can find bus drivers tomorrow. It's not like, we can find teachers tomorrow. It seems like a really intractable problem.
No, I think it's a huge problem. I don't think there's an easy way out of any of it. And in my Facebook post, I was saying that teachers are going to leave and we need leadership to step up and try to find solutions. But yeah, those solutions might not be quick, and they might not be even possible in the short term. And that's the situation that we find ourselves in. I think there's, frustration with, for me and for other staff, kind of a lack of acknowledgement of the extraordinary circumstances that we're being put in. And also a frustration with the feeling that there's a lack of planning, that we should have known that there was going to be a massive shortage of substitute teachers. And even MCPS's own policies have helped make that shortage worse.
Okay, what is
things
that?
Like that. So there's a shortage of substitute teachers. There was a shortage of substitute teachers before the pandemic as well. It's always been difficult for especially elementary and middle school teachers to get substitutes because they don't pay them a professional wage. They're basically paid a wage that you would pay somebody to come and be with the kids, but not a professional teaching wage. So during the pandemic, a lot of our substitutes are older and didn't feel as comfortable with some of the online teaching technology. So we lost a lot of substitutes last year due to that. And then MCPS has a policy, a longstanding policy, that substitutes have to work at least 5 days each semester in order to stay employed in the substitute pool in MCPS. And so last year, many substitutes did not meet that requirement, either first semester because they weren't comfortable with online teaching, or second semester when we were back in the building because maybe they hadn't been vaccinated yet and they didn't feel comfortable being back in the building with students yet. So instead of loosening up that policy to try to get ahead of the substitute crisis, MCPS did nothing about that. And now there are many substitutes who used to be regular, multiple day a week substitutes who had to reapply for their jobs in August and still have not been admitted back into the system to work.
Okay, that seems like a really practical thing to be able to fix. Thanks, and hang in there. I'm not sure what the solutions are or how soon they're coming. You're listening to I Hate Politics. I'm Sunil Dasgupta. I'll be back with MCPS COVID-19 coordinator Heather Dublinske. Heather Dublinske, welcome to I Hate Politics.
Thank you so much for having me, Sunil.
Great. I am so happy that you're here, and we want to know more about MCPS and more about COVID-19 response in MCPS. And I believe you're the point person. Can you describe what your formal role is?
Sure, absolutely. So I have been in Montgomery County Public Schools for the past 20 years. I'm actually a graduate of MCPS, so born and raised in Montgomery County. I started in human resources and staffing 20 years ago, and then moved to become the ADA and EEOC compliance coordinator. And I was in that position for almost 10 years. And then during COVID, moved to be the assistant to the associate superintendent of operations. That position was unfortunately cut with the leaving of Essie McGuire. And I am now the COVID-19 coordinator under the chief of staff's office.
And so when did you become a COVID-19 coordinator? Also, did you have COVID-19 responsibilities even prior to being coordinator?
So if you think back to March 2020, I was still in the compliance coordinator position doing ADA, EEOC, and investigation work. And we had just closed down schools, and our former chief operating officer called me and said, hey, there's this COVID thing happening. The Department of Health is really busy trying to do contact tracing in the communities. Do you think you could just help out for 2 weeks while schools are closed in case any staff members become positive? And I've kind of worked my way up in the system of always being like, yeah, I'll do anything. Sure. So I thought for 2 weeks, I would just keep data and information on any staff that test positive. And 2 weeks is now going on 18 months. And here I am.
So you really started with tracing? Is contact tracing is what you started with?
So at first it wasn't contact tracing. It was just like, if someone tested positive, I would gather their information and then send it over to Department of Health. Then as COVID started to grow and Department of Health was, having to do community tracing in private schools, I was asked to take the contact tracing training, which I did, and then receive additional training from school health services and the Department of Health so I could provide additional support for in-school tracing. But remember, this is a time when only staff were working. Students were not in school, so I was not having to do any contact tracing for students. I was really focusing on staff so we could quickly address COVID issues, have staff go home if they needed to quarantine, and try to separate people as much as possible.
And were you the only person doing this, or were there other people?
I was the only person, and as of now, I'm still the only person. Thankfully, we did just hire new contact tracers and COVID response support, and they'll be starting within the next week. They're going through the contact tracing training now, and hopefully we'll have them ready to go by next week to support our schools.
I heard you're hiring 10 people. Is that correct?
Yes.
All right. So maybe you can have dinners at home.
Yeah, no, I'm really excited to, just have the extra support, but most importantly, to be able to support schools faster. Being only one person, I can do two things at once. I can be on one phone call and one email at the same time. So having extra people to get back to schools quickly to help identify the close contacts in the classrooms, really supporting the contact tracing process and making sure that we're making safe decisions for students and staff.
Were you involved with the policy around quarantine? Were you involved in making that policy?
So MCPS doesn't make policies. We work with our local health department to make decisions and recommendations and guidance. And the way things progressed over the summer was interesting. I mean, Sunil, I think at one point all of us kind of thought, COVID's not gone, but we're in a much better place. Maybe around like end of June, July, we weren't required to wear masks indoors anymore. We were able to not be, 6 feet apart in restaurants, and things kind of felt like they were getting more back to normal. Unfortunately, until, Delta hit us pretty hard in the beginning of August, when we're really starting to just ramp up to plan to go back to school. And our transmission rate within the community got to a level that we had not been in since February of 2021. So to get back up into that high transmission rate, we really had to readjust based on the information and guidance we would be given by our, health experts. And that was to quarantine students who were possible contacts of students with symptoms. After further evaluation of that and kind of tracking the data through that first week, how many were actually testing positive? Was there spread within our schools? We have to take the whole picture into account when making health decisions for students. not only their physical health, but their mental health, their emotional health, their educational health. And so we were able to work with Department of Health and reevaluate, and now are only focusing on students who are known close contacts to someone who is positive.
Okay. So can you give me a sense of the timeline that, when did you make the decision? When did you see the community spread rising? And when did you make the decision to establish this quarantine policy? Just sort of, because oftentimes what happens is, it's like the health department said something and then the community transmission rate was, so I think just some clarity would be great.
I think just one thing to clarify first is that our Department of Health and school health services experts are the ones leading this process. So they are the health professionals. They're our Department of Health. We rely on them for their guidance and support. So our in-school health services professionals, the health tech or the school nurse, those are employees of the Department of Health. They are not MCPS employees. So when decisions are made to send students home or advising on who's quarantining, MCPS is supporting and communicating those decisions, but we rely on our health partners to lead us in that.
Okay, so who specifically makes the decisions then? So if you say that the nurses are making the decision, or the chief of nurses is making the decision, or the Department of Health is making the decision, who in that office is actually making those decisions?
Regarding who to quarantine and who.
Correct. Yeah. Or just quarantine is just one example. Who in the health department is actually responsible for these? It's unclear, actually, even from as far as, people that know the system well don't know who does that.
So outside of any executive orders that are put in place by, county council, like if you remember, we had executive orders that you had to wear masks places and you had to be 6 feet apart. Those have all been lifted. So, our former health officer, Dr. Gales, he provided guidance to MCPS and made recommendations. And because we are a collaborative partnership, we would align with those recommendations.
So the quarantine recommendation was made directly by Travis Gales?
Correct.
So throughout the pandemic, Travis Gales was the person that was leading MCPS health decisions? And you all didn't have anything to do. Basically, he would give you, say, this is my guidance, and you would follow.
Yes. There were times where we had difference of opinions, recognizing that a school system has, we're a large school system. We have to make different decisions. You may remember back in the spring where we were requiring people who had traveled over spring break to test and quarantine following travel. That was a decision that MCPS made based on the needs of our students in our communities.
Okay, that's interesting. So does MCPS and the Department of Health and Human Services, do you all have an MOU, a memorandum of understanding?
I'll be honest with you, I can't answer that because I'm sure we do, but it would be with the general counsel. And so I don't feel versed to speak to that.
Mostly when agencies work together, right, they have a memorandum of understanding. I was just curious whether that memorandum of understanding would have been updated because of COVID. But seems like if you don't know about it, it sure was not updated, right?
No, that's not. I know we have MOUs with our partner agencies. That is a separate, part of the work that I wouldn't be involved or privy to. That would be through our general counsel.
That's interesting, right? Because the MOU would govern your work, your relationship with the Department of Health and Human Services, and you don't know about it.
I don't want to say that I don't know about it. I'm given guidance by my supervisors, and we all work closely with the Department of Health. I am sure there's an MOU in place. I just don't work in general counsel, and that work is done through our attorneys.
So if there's an MOU that governs that relationship, surely, the person that is responsible for COVID coordination would know about it, would be able to refer to it, would, have direct knowledge of it, but you don't.
I don't. So if there's an MOU, I've either been told of the pieces that impact me, or it's not directly related to COVID, and just an overall MOU, the partnership we have with the Department of Health, which covers so many areas. I mean, COVID's a teeny tiny piece of our relationship with Department of Health. I know some of our other partners with like the, Montgomery County Police Department, Montgomery County Child Welfare Services. We have MOUs with them that are public. So imagine that the DHHS one would be. I'm happy to look into that for you.
Yeah, no, that'd be great. If you could send it to me, even after the interview, I would really, really appreciate it. Were you involved in the discussion about outdoor lunch?
I mean, I think we're all involved in those discussions as they come up in different areas of our work. But, outdoor lunch is another way that we had to quickly pivot. Again, when we start planning for next school year. We were starting planning for this current school year, starting in January of last year. That's how long, on ramp, especially as things were changing so fast. So we had really been planning a long time, and the guidance and recommendations were ever changing throughout the summer. Again, we were kind of in that hopeful state at the end of last school year and in the beginning of summer, where CDC had lifted their restrictions on distancing in the classroom, saying that you can no longer need to keep 6 feet apart, and that physical distancing should not be a barrier to returning students in school. We heard from the governor that the expectation was that students would be in person 5 days a week. That was a commitment that Dr. McKnight made, 5 days a week in person with a teacher. And so we planned based on that information, which means having schools at full capacity. And knowing what a large system we are, it's difficult to have that distancing in the schools. And once we realized again where we kind of were in August, we had to pivot and find ways to keep students safe, and especially in those times when they're eating and aren't wearing masks.
But you didn't expect that cafeterias would be a place where elementary schools students who are mostly unvaccinated would be there and eating without masks, and you couldn't social distance, so maybe going outside was an option. That didn't come up between February.
I mean, absolutely. Schools, we provided different options to schools. Look at spreading students out within the school in large areas of spaces. Use outdoor areas. We absolutely promoted the different variety of options for schools to implement on their own. But as things kind of progressed and we heard feedback from our parents, we really pushed that outdoor option as we know it's the safest way for kids to eat outdoors and space out.
So, one of the issues with MCPS has been historically, not now, for decades, is that, there is variability. Variability between schools. Variability is a nice way of saying inequity. And, so even with outdoor lunch, what we do see is that some schools are way ahead, where they have better homeschool partnerships, more robust homeschool partnerships. They are ahead where they have stronger PTAs. They're probably ahead, and other schools that don't have that, and historically probably, schools with a larger, minority and poorer populations, don't get the benefits of this kind of policy. Did you think that variability was going to be an issue?
We all recognized that it was going to be an issue, which is why we set up the process the way we did, that schools were not to have their PTAs purchase items directly for the school, that they could make a donation to the MCPS Educational Foundation. And then as schools needed resources to provide for outdoor lunch, be it picnic tables, tents, other flexible seating arrangements, those purchases would be made through the Educational Foundation.
Right. So it didn't work out that way, though, right? And what happened was that those in the richer parts of the county, I beg your pardon, were able to go to outdoor lunch faster and quicker than others in the less well-off parts of the county. So even despite the direction that PTAs couldn't purchase, it really was different. There was a lot of variation, and there still is. I'm hearing every day.
There definitely is variation. I have been so impressed by the way our schools have come up with creative solutions to thinking. Some schools have their kids, bring a towel or blanket every day to kind of do picnic style while they wait for their tables or flexible seating to come in. Some have like kind of outdoor cafe areas where they've set up, tables that were already existing there and just rearrange them to meet the students' needs. You have to remember, we're not the only school system implementing this. So the availability of resources and equipment is limited.
But what equipment do you need when you can get a towel and sit, as you just described?
I mean, that's
but why aren't all 209 schools doing that? Why is it not 209? Say the 140 elementary schools. Why are not 140 elementary schools doing that?
I think some schools were able to get existing resources that they already had in place outside faster. I know many schools took their tables and placed them outside. Other schools wanted outdoor lunch to begin with, so start planning for that in the beginning before we started kind of encouraging it even more than we had originally. And I think other schools were just able to implement faster based on making those requests for materials before they became limited in resources, and we had to order or we're backstocked on some of them.
Okay, that's fine. All of those I accept, but did you not expect all of those to happen? I mean, not you personally. The question really I have in my mind is that, is the COVID coordinator leading that outdoor lunch effort as well? Or were you in the background saying this is what we should do and then leave it up to schools go, okay, they did it or not? It's not in your hands anymore. So
I don't lead the COVID work as it relates to implementation in schools. This is a team effort, really. Yeah. I'm not the one working on this. I'm so thankful for my colleagues and partners who help out in tremendous ways. So there's different areas. We had those recovery groups that we had parents and our community partnership groups on, where we were getting feedback and information from them all through spring and summer. And so there were different groups making different decisions. And so where I provided guidance on, here's what the CDC recommends, and here's what is, other school systems are doing, and here is what I think is it's group decisions that are made. And
correct. I think so. There are a number of people who are responsible, and consequently nobody is, right? It is the way of all collective action, is that unless you have a mechanism to bring it about, right? If you personally are not going to be held responsible, then that's not your responsibility. One thing that I was thinking about is that, in terms of responsibility, right? I felt in, talking to, sort of listening to principals, not talking to them so much, but listening to principals and listening to parents, I felt that, schools and principals, if somebody were to get COVID in their school, would not ultimately be held responsible for that transmission. However, if in order to prevent transmission, they were outside, and God forbid a child walked away, they would absolutely be held responsible. Do you think that's sort of a perverse incentive that is in play?
I think with COVID, it's especially as we are, open to the world more than we have been in the past 18 months, it's difficult to pinpoint where somebody has contracted COVID.
Correct. There may
be exposure to school, there could be exposure to a birthday party, a soccer game. There's so many interactions that we're having that oftentimes you never know where you got it if someone gets it.
That's correct. And so, so responsibility is diffused, right? And so schools and principals don't have that responsibility. Compared to that, if a child should walk away from an outdoor activity, they have full-on responsibility. I mean,
absolutely.
That's a huge difference.
They're responsible for supervising students while in their care. So that's something that is controllable, where knowing where people are exposed in and outside of school is something that we only have limited control over to do the best we can with the mitigation that we have in school.
Right. So we control what we can. We don't worry about what we can't.
I mean,
it's perverse, though.
I worry about it all the time.
I'm sure you do. That's your job. I have no doubt that you do. There is a lot of talk, and I actually talk to a lot of folks about sort of communication between the central office and school communities, right? Do you think we are where we need to be with that piece, especially around COVID communication?
I think there's always opportunities for improvement, and I'm not using that as a cop-out. I'm going to explain what I mean. I think in many areas we communicate well and thoroughly about what we're doing to keep students safe, the plans we have.
Give us a few examples of that. Where did you do it well?
I thought we did it well with putting out our recovery document before school started. So parents and community knew what to expect when their students came back to school. Here's what it's going to look like. Here are the mitigation strategies we've put in place without it being too dense. Remember, we're communicating to hundreds of thousands of people. So we have to make it easy to understand without putting too much information into it, while still giving the information that is needed for people to feel safe sending their kids to our care.
Okay. So you did a good job there. And where do you think you came up short?
I feel like there can be improvement, and there will be improvement in the way that we communicate our COVID cases within schools. And that responsibility lies on me, because the current process falls on me when there's a COVID case in the school and a principal sends it out to their community. They send a letter to me. I send it to somebody else to post on the website. So it's a very manual process. It's not like the school sends it out and it's automatically popped up on the website. So it's going back at the end of the day and looking through my emails, making sure I didn't miss one. And Sunil, sometimes I miss them. And
I am sure you do, and I do not hold you responsible. I honestly, that is not the part that I'm talking about. I'm talking about where there's confusion about what is going out from central office to the schools, and from schools to the community. Sometimes the letters are inscrutable. I don't understand what it's saying. So where do you think that improvement can come from?
I think looking at making the information for principals to provide the information in an easier way. We're setting up a dashboard that's going to have all the information where it can be entered directly by the principal. That'll automatically generate the letter that goes to the community.
But why was that not done before school started? That piece should have been done, right? The reporting piece, that the back office, part of that. There should be there should have been a dashboard. We've been in this for 18 months.
And we had looked at different ways to communicate the information. When we brought students back, we started using the letter format. And for a long time, we felt that was working. And once we realized it was not working anymore, now we're moving to something that will hopefully give better communication and transparency into the cases we have. But I will say, Sunil, if you look at Montgomery County compared to our other local school systems.
Okay, tell me which one fares badly.
I don't want to talk badly about others.
But you did. So you, if you are going to compare, so really compare. Go ahead. Go full on.
I would say our largest neighbor school system has no dashboard on their website and no communication about their COVID cases on their website.
So you're talking about Fairfax?
No, in Maryland.
Prince George's. Okay.
And they provide their daily Department of Health metrics, but they don't provide school-specific information about cases in their schools.
Okay. What were you planning about testing over the summer? And how did that evolve?
Sure. So you recall last year we were doing pool testing, which had mixed success based on the number of people that opted in and just based on the kind of nature of pool testing. I personally felt that while it was good to identify the students who were obviously positive and have them removed from possibly exposing others, I did feel without that immediate follow-up PCR to find out who in the pool was positive, it kept students out longer and more than they should be. We weren't able to provide the PCR on site. We were relying on families to go do it on their own. Provided them with access and resources to do that, but it didn't always happen. Mm-hmm. This year, we knew as we were looking into testing, we wanted something that would do individual testing at the school level. We knew that the Department of Health had a program where they were going to be funding testing. During the summer, we were in a low community transmission rate, and based on the CDC guidelines, they don't recommend in-school testing when you're in low community transmission. So as we watched numbers go up over the summer and we went into moderate and substantial transmission, that is when the CDC recommends implementing in-school testing. So we quickly connected with the State Department of Education and the Department of Health to identify one of their pre-approved companies that could provide that on-site testing for us. And we have rolled that out. We just started last Monday. We are in 50 schools currently, and we're adding additional schools each week.
Okay. So I believe that the MCPS leadership asked County Executive Mark Eldridge for test kits. Is that correct?
So those are rapid test kits, and that testing is different than the on-site screening testing that we're doing through the state. We have now also gotten resources and are now in both of the state testing programs, screening testing, which is that testing where you opt in, your students tested once a week, and then the rapid on-site testing, which is called diagnostic testing, which is given to students who present in the health room with COVID symptoms.
And so you didn't have those tests?
We did have those. We had a large number of tests from the state that they had provided us last year. Again, remember, when they provided it to us, students weren't in school. So when they sent us the test in November, we didn't have students back until March. At that time, we were doing the pool testing. School health was just bringing staff back into the health rooms after having them deployed to do contact tracing. Many of the nurses were still doing vaccination sites, testing sites. And so they were also limited staff. And so since we were doing pool testing, we didn't implement the on-site rapid testing at that time.
And so where these tests were just laying around in some warehouse and you didn't know about it, they were expired. What transpired there? So
we knew the tests were there, but that we didn't have someone to administer the test in the schools. They had an expiration date of May of 2021. We did not discard them because we wanted to be mindful of the products and had not thrown them away. So as we kind of watched the transmission go up and wanted to add additional mitigation measures and more testing, that's when we reached out to the Department of Health, the county executive, and the state to confirm, one, we need more tests. And when we made that outreach to the state, they said, wait, if you still have the test from last year, they're still good. The expiration date just got extended. So we were like, great, we'll use those until we can get new ones. In the way that you have been talking about, the summer and the planning period, it strikes me that the assumption for maybe from March to June, July even, was a very optimistic assumption that, we were on the mend, we are going to get out of this. And there wasn't sort of a belief that, what if things turn south? What are we going to do? And in disaster planning, at least, maybe not in pandemic, but I would imagine in pandemic planning as well, that those worst case scenarios are often what the planning is about, right? Not the best case scenario. Do you think that we made some errors in sort of being more optimistic about what the trajectory was going to be in our planning process, and maybe address how you might fix that? I don't know if there were errors. I think, we all went into summer kind of optimistic about the changes we saw, and as we saw executive orders get lifted, but behind the scenes, we were planning. We were saying, if this happens, we have this to rely on. We knew that this state had a testing program that we could use when transmission rates went up. And as soon as they did, we reached out to them to implement that. Regarding lunch, we knew that we had outdoor plans that we could recommend for schools to use if that need came up, which it did. So we had all the plans. Where I feel like people think that we weren't planning is because we don't have this stuff immediately. But you have to remember how large a district we are. If we were to have ordered tents and outdoor tables for every single school as the worst case scenario planning, where are we going to store all of those? Where are we going to put them? What are we going to do with them if we don't need them? So I think part of our planning is making the plans that we can put into action as soon as we foresee or come against a time when they're needed.
Well, even with the ordering the tents and tables, it's sort of, a very specific example. But even with that, I mean, if you're planning for this in December, January of 2020, 2021, there is enough time to figure out storage. If you're planning for it in June, July, no, there isn't.
I mean, the storage, that's just an example, but the storage doesn't change between December. We don't get more space between December than we do in June. The space limitations that we have and the capacity limitations that we have exist because the size of our school system. I think for parents, and obviously I am a product of MCPS. I was a parent of MCPS students. It's easy to kind of have this narrow view of your school community and your cluster, not realizing how massive we are, and just implementing things system-wide is challenging.
Thank you so much, Heather Dublinske, for coming on the show. I really appreciate it. I also want to say I really appreciate your work. I know that you are working hard, and I know that you're working tirelessly. As I said, sometimes we don't see it, but that doesn't mean that's not happening.
Thank you, Sunil. I just want you and our other parents to know there's nothing more important to me and my colleagues, the best interest of our students, and I will always put that at the focus of my work.
I was a younger man, I chased you through the fields that we painted with soft brushstrokes. Now I sit in my old age and watch the pain as it fades, the memories they give me hope.
What lessons can we draw from my conversation with Heather Dublinske? First, it should be abundantly clear that Heather Dublinske cares and cares deeply. But it is also clear that individual heroism, which she displayed, in ample measure, cannot overcome institutional and structural failures. Faced with an unprecedented situation, and given a lead time of months, if not more than a year, why was MCPS and DHS, the county health department, unable to formulate an agreement that defined each other's roles and responsibilities? Why is all this so ad hoc, so on the fly, or as they like to say, building the plane while flying it? Take one consequence. MCPS is now hiring 10 contact tracers after it became clear that principals and assistant principals and sometimes teachers were left with the task of contact tracing. The health department had cut its contact tracing staff, and there was no coordination that told them that once close to 100,000 unvaccinated children below 12 go back to school, there would be more positive cases. Heather Dublinske emphasizes that MCPS took its medical guidance from the health department, but the health department didn't have to understand or manage the cost of those decisions. There were task forces and design teams and work groups and committees, but in the end, there was no clear delineation of who was responsible for what. This is not a failure that belongs to Heather Dublinske, but to MCPS and DHHS leadership. Second, how do good, decent individuals come together to make poor decisions? We have an answer in social science, if you ever want to read about it. It's called the problem of collective action, where individual and collective rationality are sometimes at odds with each other. Government failures in so many cases are rooted in how preferences are aggregated in groups, in how the left hand and the right hand don't know what each other is doing, let alone work together. I won't belabor the point, but this is not a lesson you will learn in a STEM class. Third, MCPS is taking steps to address these issues. It is hiring more, which Dublinske is very happy about. Several days after her interview and following her pursuit of a possible MCPS-DHHS MoU, she wrote me that MCPA has just created an additional partnership and have invited DHHS representatives to join our COVID-19 operational advisory group. So, more committees, but no agreement on how to share responsibility. This is in September 2021, 18 months after the first lockdown. That's all for this episode. You've been listening to I Hate Politics. I'm Sunil Dasgupta. Music for this episode comes from Two Truths, a Rochester, New York-based electronic Americana band with roots in Montgomery County. Garrett Mader and Blake Pattingale composed the music, with Max Greenberg on keyboards and Byron Cage on drums. The band's first EP, Electric Campfire, comes out this month. If you want to share your music on the podcast or know someone else who might want to, please email us at ihppod@gmail.com or reach out on Twitter at ihppod. I hope you'll subscribe and share the podcast as we bring you stories about politics close to you and your home. See you next time.